So Mary Beth, if there were one thing you would change to improve patient safety, what would it be?
I think that in terms of patient safety in the hospital setting, that there are many times where we bring in new processes or new procedures and we won't really look at the workflow or the people who have to implement those procedures, and so there's lots of inefficiencies that occur. And when the inefficiencies occur, it causes people to have to rush around, and that's when we see workarounds occur and patient safety near misses and incidents happen.
So instead of a matter of patient flow, it's more a matter of staff flow.
Yes, and in terms of staff flow, it affects patient flow and impacts patient safety as well.
What really brought this issue to your attention?
I think in terms of computerization and technology, there are often times where we bring in new pieces of equipment that cause different workflow patterns for the staff. And although we teach the staff how to push the buttons and work the pieces of equipment, we don't often consider how those pieces of technology impact the workflow of the nurses and the patient care technicians or nurses' aides or other staff in the facilities.
What are some of the tools then that organizations can use to really sort of review their processes and the flow around the department?
So one of the very easy tools that can be used to look at workflow in a facility is to look at a spaghetti diagram, which is actually just a visual diagram of how patient care is delivered in terms of, for example, the nursing staff and where they have to go exactly on every unit or from patient bed to bed to accomplish any type of task. And it's really just a visual diagram, for example, of the floor, where you would follow a nurse throughout a certain procedure or workflow and look at how many times she has to maybe walk up and down the hallway or go from one clean utility room into a patient room to the desk and back to the patient room. And it's a very visual and easy way to identify some of the efficiencies or inefficiencies that may be occurring, possibly as a result of the new technology, as I said, or a new procedure that you've implemented on a unit.
And so that sounds like something that can be done fairly immediately, whenever something new is implemented.
Yes, and it's very easy to implement. It's very easy to look at. It does not take anyone who necessarily has been trained to do it. So it's a great tool to utilize. As I said, it doesn't take very long. You do need to follow a number of nurses around because you may find that on a particular unit, a number of different nurses or a number of different nurses' aides may do things differently. So in order to really understand any of those workflow processes, it really just requires following someone around on a daily basis for a period of time to gain an understanding of the workflow that's occurring.
And then what are some of the changes that can be made as a result of understanding the findings of something like a spaghetti diagram or another process review?
I think in terms of what changes can be made, it helps you to gain an understanding of the workflow that's occurring, the different workflows that are occurring, and potentially look at where some efficiencies can be gained. So for example, you may need to consider moving clean utility rooms. You may need to consider reworking a procedure or a policy as a result of this to see where some of these efficiencies can be gained, because the more time that a nurse can actually spend with a patient, the better. So we don't want the time spent on work inefficiencies.